That's a good thing that, it's not like you'll be studying from books for the whole journey. Yeah.
And is that something you enjoy? Because I remember listening to one of your other interviews, Priscilla, and you said that one of the things you really enjoy about, you know, being a, I mean, hopefully being a medical professional, but being a student is that patient interaction piece. And I
Mhm.
think the way doctors speak to their patients or can really affect the eventual well-being or the eventual outcome. So is that
Definitely.
something you really enjoy, the patient conversations?
Yeah, yeah, for sure. I mean, I'm still very early in my journey, and like I've had some very impactful patient experiences. And even, when you try a little, like when you go just the extra mile for a patient who you see is struggling, like even just explaining to them what exactly their condition is, because a lot of times we're so caught up in trying to like manage the patient and give them the right treatment that we forget to like sometimes fully explain what's even going on to them, and they're confused, or their family members are confused. So even doing simple things like that makes all the difference for them. And I've had a f- I've had a few people say like, thank you so much, like I can tell that you care. And that means so much to me that like someone else is able to see that, because I do care about these people, and I want the best for all the patients that I've seen. So um, when they see that in me, it really it really does fill my heart and makes me more motivated to like be a good doctor, be a kind doctor, be an empathetic doctor, and just remember that they're people at the end of the day. They're not just like another number or another patient, but they're people, and they deserve like respect and all of that. So yeah.
That's really powerful, Priscilla. And I remember I think it was the same physician, Atul Gawande, and I really enjoy reading memoirs by doctors. And in one of his books, I think it was Being Mortal. You probably um, heard about it somewhere, but he mentioned that um, in I think it's palliative care, which is care at the end of your life, and he spoke about how sometimes at the end of an individual's life, rather than wanting to live more, the person may have this decision where they actually want to lead a comfortable life around their loved ones, and
Mhm.
the only way to actually know that is to have a conversation with them about what their priorities are at that point in their life. And I actually used some of those principles in conversations with loved ones in my family, and I think there's this delicate balance of empathy and professionalism that you have to tread as a medical professional,